and welcome to the Pursuit of Healthiness Podcast. I'm your host, Renanda van Delft. I'm a health and mindset coach, spaghetti and ice cream lover, travel junk, and a cat mom. I love conversations that are on a more raw and deeper level. And today I have with me Dr. Linda. Dr. Linda is a board-certified pediatrician who is also board-certified in Pediatric, Infectious diseases, and in Integrative and Holistic medicine. She has helped thousands of parents just like you over her 33-year career. Today we are going to talk about fatherhood. Fathers are really, really important. So, how do you become a super dad? Welcome, Linda, to the Pursuit of Healthiness. Today, I am excited about this topic we are going to talk about today because we're going to talk a little bit about fatherhood and just everything that has to do with that. And I think dads are really underestimated in these days. Like, it's always the focus on the mom and the father gets left behind, but he's as important as the mom is, I believe. And you know everything about that. So can you tell a little bit about yourself and what you do and what we are going to talk about today?
Yes, my name is Dr. Linda Abujaber, and I'm a board-certified pediatrician from the United States. I have 3 board certifications actually from the United States. One is in general pediatrics, the other is in pediatric infectious diseases, and the third is in integrative and holistic medicine. I also carried the board in general pediatrics in Jordan. Okay. So I try to be very culturally aware in everything that I speak about, because where you come from does inform how you think and how you behave.
Yeah.
However, I've noticed that in terms of fatherhood, there are a lot of myths, and I hate to say wrong, but there's misinformation in every culture I've been in about the importance of fathers. And so a few years ago, I set out to teach dads how important they really are, and to teach moms how important getting dads involved is, because I heard the same questions over and over again. I've been a pediatrician for over 30 years. I had my own holistic medicine practice for 15 years in a small town in Wyoming. I do hypnosis, I do homeopathy, I do Chinese medicine, I do acupuncture, I do nutrition, I do coaching. And I came to all this, Winanda, because I hated to tell parents there was nothing they could do. That's just, when my daughter was born, she got very sick, and I said, well, what's going on? They said, we don't know, and there's nothing you can do. And I thought, well, gee, and thankfully she's fine. But I really didn't like hearing there's nothing you can do as a parent. And then my son was born with a little bit of a unique eye problem. And I was lucky enough, I was still doing my training then. I went to a doctor who was the foremost expert in the world on this thing. It was called Duane syndrome. And the guy said, there's absolutely nothing I could do. My son would have a funny looking eye the rest of his life. And I said, you know what? No. So I set out to look, and that actually is what started me on my holistic or integrative medicine journey. Because as the longer I practiced, I thought, well, maybe my experiences with my kids were unique and I'm special or something like that. Turns out I'm not. And being on the receiving end of medicine on numerous occasions really made me know that we have to look into alternative. I don't even like to call them alternative anymore. They're holistic. You know, there's not one pill for one disease. And that's why I wanted to be on your podcast, because I think the message that you're giving is tremendously important. Because, you know, I believe that because I'm a pediatrician, I believe that empowered moms and dads raise healthy, happy, resilient, aware children. And they thrive themselves. And one of my missions is, besides to create a healthy, happy world for everybody, which sounds kind of funny, but that's really what I want to do, is to have parents avoid doctors whenever possible, and only, and know when they need to go, because doctors are very, very helpful when you need to go. Yeah. But I've heard so many horror stories about people going to doctors and being told this and that. My mission is to make parents aware. This is what you need to know. If this happens, you do need to get expert help.
Yeah.
And I also want parents to be empowered to know that they know their children better than anybody else. So let's say you go to a doctor and the doctor says, do this, and it doesn't sit well with you. Find another doctor. Research it. Go back. If you really like your doctor, this is what I always used to tell my patients. If I tell you to do something and you don't like it, let's talk about it. Let's find out what your hesitations are. And, we always ended up making a decision together.
That is better. That's great.
Because you are the expert on your kid, or you are the expert on your body, and then the doctor is the expert in general. And so in my Superdad formula book, I didn't write about here's what you need to do. I don't believe in that. I believe here are general rules that you need to be aware of. This is what most kids behave like. This is what most relationships go through. This is what most moms and dads go through. First off, so that they would know that they're not alone, because, being a first-time parent is incredibly isolating. There's a lot of shaming involved, a lot of judgment. And the real problem is the shaming and the judgment doesn't always come from outside. It comes from inside of our head. And so one of my missions is to teach you how to deal with those voices inside your head, because they can be the most destructive of all. And again, I wrote the Superdad formula because dads are very hesitant to share their real feelings and their real experiences, because when the baby's born, they think, I have to be strong, I have to provide, I'm supposed to be the strength that everybody comes to. And they end up
They have to be the superdad.
Yes.
They feel like they have to be the superdad.
And there's nothing wrong with being a superdad if you have the right skills.
Yeah.
Stuffing your feelings, stuffing your needs, stuffing your fears, not asking for help are not healthy, not just for the dad, but for the mom and for the baby. Because studies are showing now that fathers who are involved from time of pregnancy have children who are not only physically healthier, they have less incidence of colic, they have less behavioral problems at 3 to 5 years of age. They do better in school, they're more creative, and they're better at problem solving. Yeah. So dads really need to be aware of how important they are. And so I wrote, based on my book and based on my experience with lots and lots of parents, I've been very lucky because over the years, I had relationships with my parents, both the males and the females, or the masculine and the feminine parents. And they would tell me things that they wouldn't tell other people because they knew I wouldn't tell on them. Yeah. And so I was very privileged to be able to see firsthand, this isn't just research that I did. I was privileged to see firsthand the fears that dad have and the things, and the ways that I taught them little things that made huge impact, not only on them, but on their relationships and on their children. So here's a very short list of things that I believe are the basics of being a super dad. Okay, first off, a super dad is curious. He doesn't know everything, because you know what? If you know everything, you can't learn anything. Yeah. He's open to learning, but more important, he's open to asking for help and support. And he needs to be careful where he goes for help and support. I mean, other dads at his same level may, where he is in the journey, may not be the best source. Maybe a grandfather, maybe a father, if they get along, maybe a trusted mentor. So that is very important that they're open to that. They're not afraid of making mistakes. Men have this thing about, I don't know how to do it perfectly, so I'm not going to do it at all. Mm-hmm. And that's a problem, because you know what? Women are not born with the gene of, I know exactly how to change a diaper. I know exactly why the baby's crying. And I've had so many dads tell me, moms know how to do all this stuff, and I'm going to let her deal with the baby when they're very little. And then when we start talking and playing, I'll play with them. And I'll say, well, first off, you got to know that your wife doesn't really know much more than you do, unless she's been around babies or she's had training, she's a nurse, she's a doctor, something like that. But I have to say, when I was a board certified pediatrician when I had my first baby, and I was shocked. I mean, parenthood was nothing like I thought. And I was prepared. I was the expert people came to at the time for parenting advice. And I have to say, I also became a very different pediatrician after I became a parent, because it's like, I used to say stuff and now I cringe to think those things that I say. But I wasn't a pediatrician for very long before I became a mom, so I didn't do too much damage.
Okay.
The super fathers are working on being self-aware. Now, what I mean about that is they're willing to take responsibility for how they feel. They're not looking at the wife or at their partner or at the baby and saying, you're making me feel like this. They're saying, okay, I feel a certain way. I'm going to take responsibility, not to blame myself, but to take the steps I need to deal with my stress. Because let's be honest, being a first-time parent, being a parent in general can be overwhelming, and there's a lot of stress involved in it. And with COVID and the change of life and the fears that we have, stress is, and everybody is on the rise. So that's one of the things I actually wrote about in the book, which I published pre-COVID, was how to manage your stress in healthy ways. A father that's a super dad thinks before he acts. He doesn't, a lot of what happens is we talk about intentionality a lot.
Yeah.
And I remember when I was a first-time mom, things would fly out of my mouth that I promised myself as a kid I would never say to my kids.
I think a lot of parents have that.
Yeah. So I came up with something called the STILLS method, which is stop, take 3 deep breaths, investigate how you feel, lean into it. So allow yourself to feel angry. There's nothing wrong with feeling angry. Yeah. And I think too many people suppress their anger. And I think that's one of the reasons we have a lot of cancer in the world right now, is energy that's not expressed in healthy ways it works against us. Mm-hmm. Lean into it and then let it go. And then decide, set your intention for how you're going to go forth. So let's say something was about to fly out of your mouth. You were going to say something to your partner that you knew you were going to regret. If you stop, you imagine a nice big red stop sign, or have them around the house if you tend to have issues with that. Have them around the house and look at them. And then take 3 deep breaths. That breaks the cycle of the fight or flight cycle. It actually lowers the level of adrenaline and cortisol that you're secreting. So that gives you access to the higher levels of your brain. Once you have access to the executive and the higher levels of your brain, you're not going to act from your instinctual mode where you're attacking somebody who's about to hurt you. You're actually saying, is what I'm going to say helpful? Is this the right time? Am I going to say it in the right way? So you investigate how you feel. Am I angry? Am I sad? Am I feeling defensive? Am I feeling like my partner isn't appreciating me? And that actually gives you access to a whole bunch of different avenues that aren't available to you when you're not being intentional. That's why I like parents to learn this little method.
It's a great method. It's a great method. Like I think you can use it in life in general, not just for parenting.
Yeah. But I don't like to I can talk about life in general because I lived a lot of life. Yeah. But because I talk to parents, you see, the thing is, the way we talk to our children will become the way they talk to themselves. The way we talk to each other as a couple is the way our children are going to learn how to talk to each other and talk to themselves.
And once they are grown up, that's the newer generation. Like I see a lot of, if I look at the older generation right now, they really often talk bad about my generation or even below me. And I'm like, but you are the ones that raised us. So you're basically looking at yourself.
Yes. And you see, parenting is a journey of learning. Yeah. You try something and it doesn't work out. You don't stay stuck in it and say, I used to ask, my kids would say to me, Mom, I want to do this. And I'll say, you can't do it. It's just not the right thing to do. And they'd say, well, everybody's doing it. And, my dad used to say to me, if somebody jumped off the bridge, would you jump off the bridge too? It's a stupid thing. But yes, the answer is yes, if everybody's doing it, I'm going to do it too, because I'm not brave enough. Yes, I'm not brave enough to be different. Yeah. So there's a stupid joke that I like to tell. I don't know where I heard it. It's not, it's not my own joke, but this lady was cooking a roast with her mother, and they cut off this piece of roast, put it in the pan. And so the mother asked her mother, the little girl asked her mother, why do we cut that piece of meat like that? And the mother said, I don't know. We've always done it that way. And so the mother said, well, and the little girl said, well, why did we always do it that way? Is there a reason for that? She said, well, I'm sure there's a very good reason. Let's go ask your grandmother. So they went and asked the grandmother. And the grandmother said, well, the reason I cut it that way is I never had a pan that could fit the roast without cutting that piece off. Mm. So it wasn't actually a thought out decision. It was just something she did. And then it became tradition. Yeah. So, it's really important that we look back through our traditions and think about, if my mother did this to me and it was good for me, then I'm going to continue to do it. But if my mother or my father, you see, a lot of dads have a lot of fears. We're going to talk about those in a minute that we don't realize that they're having. Let's just finish the last couple of skills. The father who is aware, or a super dad, balances self-care with care of his partner, with care of the baby. And sometimes it's going to be out of balance. Sometimes the baby's going to take all of the attention. But then after that phase goes by, it's really important that he takes a step back and says, okay, what do I need? What does my partner need? How are we going to work together as a team to do this? Because, you know, dads take too much responsibility on themselves, and they forget that there's a partner there, and the partner feels left out. If the husband goes off, or the father or the masculine partner goes off and says, I'm big and strong and I don't have any needs, they don't realize that the partner is looking, but I need you. You're shutting me out. I want to talk to you. Part of what makes me feel good, or makes our relationship good, is our care of each other. If you close that door, I'm all alone, literally and figuratively. You know, you're physically there, but you're not there. So it's really important that dads pay attention to that, and moms, you see, because mothers who are aware of these things are, or women, you know, because we're more touchy-feely, you know, men don't do the touchy-feely thing. They actually do the touchy-feely thing, but they're taught to suppress it or not to express it. And one of the best people to get touchy-feely out of the husband is the wife, because there's a trust relationship in there. So that's what you want to build, is a relationship of trust with your husband or your partner, so that you can get that touchy-feely part out. You won't show it to anybody else, but as long as you are trustworthy and you don't ever violate that, it's really important.
Yeah.
And then we talked about working together as a cohesive team. It's not she gets to do everything, he gets to do everything. All the attention goes on the baby. We look at things, we say, this is what's needed for the baby, this is what's needed for our relationship, this is what's needed to take care of me and you, and how are we going to distribute all of that in a way that makes all of us happy.
Yeah.
Or in a way that, you know, I'm happy one time and you're happy the other. There's a balancing act.
Yeah, I don't believe it's 50-50. Like, there maybe sometimes it's 80-20, maybe it's 70-30 or 40-60. It can vary as long as you,
as long as you're in agreement about it.
Exactly.
I mean, it can even be 100-0 sometimes. I mean, if the dad is sick, if the mom is sick, I mean, I can't tell you how many fathers I've trained to help their wives going through postpartum depression, because people don't realize how severely untreated postpartum depression affects the baby. It doesn't just affect the relationship, it affects the baby. Babies don't make a good bond with either one of the parents if the dad doesn't get involved. They're more colicky, they have more health problems, they don't really trust people, they're fussier.
Yeah.
And they don't feel safe in the world. And I've taught many dads, I say, look, your wife has postpartum depression right now. Until she gets better, you need to step up and be the primary caregiver.
Yeah.
And it's fabulous to see, you know, here's what you need to know. You know, that you're not going to break the kid. Here's how to pick up the kid. Here's how, you know, here's a list of why your baby's crying. Here's a list of things that you can do to make the baby feel better. And you give them a little bit, and dads shine, you know?
Yeah.
But what moms don't realize is, let's say you tell he goes and changes the diaper, comes back, the diaper's all crookedy and all wrong. What you got to do with a dad, especially a first-time dad, is say, that's really fabulous. And maybe next time you can watch me do it. Don't say, oh my God, you did it all wrong. Let me do it. If you want to do anything right, you know, if I want anything done right, I got to do it again. Because guess what? That dad's not going to try again.
No.
It's just a male kind of thing, you know. You know, they want to do it right. They want to be the he-man.
Mm-hmm.
So, you know, the dads or masculine people, the masculine energy in a relationship, they seem to be driven by the 3 Ps: to possess, to provide, and to protect. So a lot of times, you know, these things need to be in balance. So a lot of times dad will think, to protect their children from them breaking them, they don't get involved.
Yeah.
And so my answer to that is, let me show you how not to break the baby. You know, the only thing you should never do with a newborn is shake them.
No.
Other than that, I've had babies, and I would never recommend this. I've had babies dropped on their head, falling out of their beds. I mean,
It
things
happened to
happen.
my sister. Like when my brother hold her, he let her fall 2 times.
Yeah,
But she's fine. Like
right. I
babies
mean,
can take on a lot.
they're resilient. I mean,
Yeah.
let's face it, the baby's head went through a canal that is way smaller than their head, and they came through it. Now, obviously, I don't recommend any of those behaviors. I recommend
No,
that
of course not.
and moms learn how to do these things so that they have the confidence. Because,
Yeah.
I mean, I watched dads sweating and bullets, carrying this kid, worrying that they're going to break him. And I say, you're not going to break him. Just don't shake him.
Yeah.
Maybe I should patent that. You're not going to break him. Don't shake him.
Yeah.
Because that's, shaken baby syndrome is a very dangerous thing. And I've had dads do that. And that's because they just don't realize how to manage. This is why being aware of your own feelings is so tremendously important. If your baby is crying and mom's not home and there's nothing you can do, walk away. Crying does not hurt the baby. And every dad that I've had that has had a shaken baby were actually very nice men. They just lost control in a minute, weren't aware of what they, weren't self-aware enough to say, I'm putting my baby down and I'm walking away. And a couple of the babies were very badly hurt.
Mm.
And that's something that, and I actually was privileged enough to watch the family actually come back together and to be part of the healing process.
That is
we make sure the dad takes an anger management class. We make sure the dads take classes in baby care. We make sure they take classes in relationships. And then once they go through all these things, slowly they can be integrated back in the family. Not sure why I went off on that tangent, but it's really important that parents know that. And in terms of providing, this is a complaint I got, oh my God, I don't know how many times over the last 30 years. My ex-husband doesn't love me. He's at work all the time. Yeah. And then I talk to the husband, of course, independently, and he'll say, my wife doesn't appreciate me. I'm at work all the time, killing myself, trying to provide. And it's really funny because it's happened in two totally different cultures, like in the United States and in the Middle East. And it's just a matter of the father's idea of providing needs a little bit of tweaking. Providing is not just about money. Providing is about providing your presence. It's about providing your strength to your partner when she feels totally overwhelmed and like life is spinning out of control. And if she has to change one more dirty diaper, she's going to run away and hide.
Yeah.
Right? And it's also providing for the baby because it's really interesting, the studies that are being done on the effect of fathers on babies. Did you know that when a mother plays with a little newborn, like 2 or 3 weeks old, the heart rate goes down, their pupils dilate, they get their respiratory rate, their breathing rate goes down? Where a dad doing the exact same thing as the mom's doing, the heart rate goes up, their pupils get smaller, and they get more excited. But it's not a bad excitation. It's not fear. It's just a different type of stimulation, and they're looking into which parts of the brain are stimulated. And interaction with the dad, interaction with the dad stimulates different areas than interaction with the mom.
Yeah, I've heard lately. I saw a video that dads often get called out because moms always know, for example, the teacher's name and their favorite book or something like that. Like moms know it all. It's what they make it out to be. But dad know different things about that kid that moms don't know. So it's so like, of course, a dad knows their kid, but just different things. But often we don't speak about that because apparently it's important to know the teacher's name of your kid and a favorite meal or something like that. You know what I mean? But that's just different
it's
things.
Important to the mom.
Yeah.
You see, and this is why relationship care is so tremendously important. And in my book, in the superdad formula, I actually give skills like active communication, empathy, how to, I need to add a part about how to fight clean, because everybody's going to fight. I mean, anybody who tells me I never fight with my husband, I get very concerned. I actually do get concerned because fighting is part of of living in the same house with anybody. When a baby comes, it's actually the birth of a baby is one of the biggest stressors any relationship can go through.
Yeah.
So, you need to learn how to fight clean, because everybody's going to fight. It's how to manage the conflict that's tremendously important.
Yeah.
Empathy means the father can look at the mother's point of view and not judge it and take it into account in the interaction. And the mother can do that too, because the mom needs to see where the dad's coming from too. He might be coming from a place that she's actually in accordance with, but because they're not talking about it, maybe the dad doesn't know the name of the teacher, but he knows everything that goes on in the class that she doesn't know. And they're not talking because they put their relationship on hold until the babies leave home. Mm-hmm. And that's not very healthy, because the marriage relationship, the health of the marriage relationship actually impacts directly on the physical, emotional, and mental health of the child. Yeah. So when you neglect that, you are neglecting to teach your kid a whole bunch of things that they need to know how to choose a partner, how to communicate with a partner. What does a good relationship look like? Yeah. How do you fight clean? Because, fighting is, like I said, is not a bad thing. I don't know why I'm talking about fighting, but it's true. Everybody wants to say, oh, I never fight with my wife. It's like, well, why not? My husband, he died not 10 years ago, but we had a 20-year marriage. In the times when we didn't fight, that meant that we really weren't getting along. So I'd go pick a fight with him.
Really?
And because the areas of communication weren't open, and I used to do that with my teenage kids too. When they used to get too quiet, wouldn't interact with me, I'd go say something that irritated the heck out of them, and the lines of communication would open up again.
Yeah, well, it's a good way. Yeah.
So dads have different worries than moms. One of the biggest, dads have the same worry as mom is, will I be a good dad? But they also have different worries. Like, I didn't have a good role model. Dads actually think about this. I did not have a good role model. I didn't like the way my dad was, but I don't know how to be a better dad. They actually worry about these things. And they worry about, what will happen to our relationship? Who's going to take care of me? They're not necessarily jealous of the baby, but they're jealous of the attention that, when you're first married and you're all lovey-dovey, and then during pregnancy you get close, hopefully, if you involve him in getting in to your appointments and stuff like that. But after that, if you take all your energy, like you're breastfeeding, all these things, dads get worried about that. Yeah. And so it's really important that during the pregnancy you address these things. And then, some dads have actually shared with me, I don't want to grow up and become an adult. I want to stay the way I am. They're that self-aware that they know that they're going to have to learn. And so it's something that, you as a couple can actually talk about, or find, somebody that the man trusts that he can talk to.
Yeah. But a thing that I also believe is that a lot of people, a lot of women and men, like, they have the feeling that they have to be someone else once they become a parent. But I'm like, but of course you have another human to take care of, but you are still you. Like, you are a person, you have your own passion, so you should not lose yourself and just become a mom and just become a dad. You are so much more, so you can still do those fun things, but I wouldn't say go out every weekend like you did before, obviously. But you still have to care for your baby, but you can still do fun things. You just have to adjust a little bit. But I don't think you should lose yourself once that becomes. And I think a lot of people use having a baby or having children as an excuse to stop doing things.
I don't know if they use it as an excuse to stop doing things, but they get so focused on the fact that they have to sacrifice themselves, which is a terrible myth. And some moms have actually shared with me, I feel guilty when I go out and get a manicure, pedicure. And I'll say, you know what?
Yeah, that's true. Yeah.
Right? It's not that they use them as an excuse. It's so beat into us.
Yeah. Yeah, I think that's more what I mean. Like,
we look at our mothers, oh, I sacrificed my whole life for you. Yeah. And you're thinking, as a millennial, well, why'd you do that? I didn't ask you to, right?
Yeah, I'm like, I didn't ask the board. You chose.
Yeah. I actually said that to my kids one day, just in a dramatic moment, because I actually did not, I was self-aware enough to take care of me.
Yeah.
After a while, I actually, in the beginning, did self-sacrifice. And then after a few years, I said, this isn't working for me. Let me figure out a way to balance.
Yeah.
So, but in a dramatic moment, I said to my kids, I gave my life up for you. And they both independently said, I didn't ask you to.
Yeah.
That was a shocker for me, but thankfully I didn't give up my life. I mean, after they were born, I learned how to do acupuncture and homeopathy, and I learned how to do energy work and, all that good stuff. And I had a full-time practice. But you see, we're left with the myth of this self-sacrifice, both fathers and mothers.
Yeah.
And what parents don't realize is the more fulfilled you are as a mother or a father, the more fulfilled your child will be. Because what are you teaching them? They're watching what you're doing.
Yeah.
Nobody,
Exactly.
A mother who feels like she's given herself up and she's a victim of her life is going to raise victims of their own life. Because unfortunately, the kid is not watching what she's saying. The child is watching what she's doing. Exactly. And if she hears, oh, I gave up my life for those kids, whatever they hear is going to be the voice that goes in their head. Oh, my mother gave up her life for me. That means I have to give up my life for my kids.
Yeah.
And guess what? Either they're not going to have kids. And I'm noticing that quite a few millennials are deciding not to have kids or to wait.
Yeah.
Or they have kids and repeat the cycle. And wounded people raise wounded people. And, my thing is, what I'm trying to do is prevent people from transmitting their wounds to their children. And one of the basic wounds is, I can't be me. I can't take care of me. And that actually goes back to a very deep underlying belief that a lot of us have is I'm not lovable and I've got to earn love. Yeah. And one of the ways to earn love is to be a super mom or a super dad. And people don't realize that person in the mirror that we're looking at is the most important person that needs to love us, because they're the only person that will never go away. And we need to grow that person, and we need to groom that person, and we need to care for that person, because that person is the center of your life. You are the center of your life. Yeah. When you are fulfilled and happy and you're showing your kid, you know what? I used to tell my kids, I'm really, really mad right now. So I'm going to go take a time out. And I would actually go take a time out. And guess what my kids learned? They'd say, I'm mad, I'm going to go take a time out.
Yeah.
And then I would sit in my room and I would think, okay, because my kids were 15 months apart and they drove me crazy some days. I mean, I think they woke up in the morning, had a little bit of a powwow, how they were going to drive me crazy, and went after me. And after a couple of days of craziness like that, I said, you know what? This isn't going to happen. I'm going to be different. And so I decided to be different. And so I started giving myself time out.
Yeah.
But that's what you see. This is why self-awareness is so important for both parents. But since we're talking about dad, that's important for dads.
Yeah.
And so, I think we've talked, how long now is it?
About 30 minutes. 30 minutes.
I can talk some more. Should I talk some more?
Yeah, you can.
Okay.
I have time.
Okay. I'm a great advocate of planning ahead. So this is part of what I wrote in my book, in the Super Dad book, is, you want to plan while you're pregnant, because you don't want, you don't realize that when the baby comes, you hit the ground running. That baby wants what they want. They want it 10 minutes ago. They don't care if you're tired. They don't care if you're overwhelmed. They don't care if you haven't eaten in a day. They don't care if you haven't showered in 10 days. They don't care, because they want to survive, and you are their method for survival. And I love children, but they got to train you, and they got to train you fast. And they'll do whatever they need to do that. Yeah. And that's why parents need to be be able to take a step back and be more self-aware. So some decisions I always tell parents they need to think about before they have the baby is, are we going to breastfeed or bottle feed? And why is that important? Because breastfeeding is not an instinctual thing for a lot of people. You really need to think about, if you're going to breastfeed, you probably should take a class, or at least learn the basics of breastfeeding. Like, the most important thing that most people don't realize about breastfeeding is that the baby needs to latch on right. If you get the latch on right, you're 80 to 90% of the way towards breastfeeding properly. Yeah. But if you don't want to breastfeed, if it's a decision that, you don't have the personality, you can't for some physical reason, then you explore bottle feeding, and you have to deal with the shame that you might come against. because there
Yeah.
is a lot of shaming amongst moms. Oh, I breastfed my kid till they were 85 years old, and you're giving your kid a bottle. And my thing is fed is best. I'm a big, big, big proponent of breastfeeding, but not everybody can do it, and we shouldn't shame mothers who can't do it.
No.
And they might not be able to do it, like I said, for physical reasons, but there's some moms that want to go back to work and they are not in a place where they can pump. Some moms want to breastfeed, and that's beautiful. And then you plan for that, does that make sense?
Yeah, totally.
And then the dad comes to the class, and that's important because the studies have shown that when the dad is involved in breastfeeding, there is a higher success rate of breastfeeding, and mothers breastfeed longer when dads are involved in breastfeeding.
Oh, really? I didn't know that.
Yeah. Well, that's why, this is why I wrote the book. It's because dads really don't realize how really, really important, and neither do moms, because I think that if moms knew this, they would lasso their husbands in and say, you got to come to this class because I'm going to need help.
Yeah, but how can a dad help in that situation? Because breastfeeding is,
okay,
the woman has to do it. So what can moms and what can dads do if they choose to breastfeed?
Okay, in terms of breastfeeding, dads can learn how to help the baby latch on properly. Dads can learn some coaching skills for the mom, because she's going to be saying, the baby doesn't latch on right, the baby's screaming, the baby's hungry, and I don't know what to do. If he took a breastfeeding class, he can say, look, the baby is only going to breastfeed for 5 to 10 minutes on each side, and then the baby's going to rest for an hour and a half, then they're going to be hungry again. So this is normal. This is nothing that you need to worry about. When the partner is involved, he can calm the mama down, or he can say, okay, let's take a deep breath. I'm going to take the baby and calm the baby down. You take 3 deep breaths, go drink a glass of water, take a cup of tea, whatever it is she needs to do. And let's come back to this, because the father can be a huge support, because most of the reasons why moms don't breastfeed or breastfeeding fails is because moms think that their milk isn't enough. And so we need as a society, we need the dads to be able to say, you are good enough. Yeah. This is normal. I am here for you, because it takes about a week to 10 days for breastfeeding to really go well. And most people don't realize that. You watch those videos on YouTube and, the baby opens up their mouth really wide, the mother inserts the breast, and breastfeeding is going beautifully. Yeah. They don't see the hours and days of agony and crying and tears on both sides where, everybody was tearing out of hair saying, I can't do this. Yeah. And the dad can be very helpful with that. Once breastfeeding is going well, he can change the baby during the breastfeed. He can burp the baby. Once breastfeeding is established properly, which is about 4 weeks, he can actually start giving the baby a feed sometimes during the night to help the mom sleep a little bit longer. Yeah. But you do not want to introduce a bottle or a nipple or anything before 4 weeks, because babies are really, really smart. People say babies get nipple confused, which drives me crazy. There are a very small proportion of babies that get nipple confused, but what it is think about it as a human being. You get a bottle put in your mouth and the milk drips, and you have to put minimal effort, or I got to open up my mouth really wide. I got to latch on to the areola, and I got to suck really hard. Which would you choose as a human being? Right?
Yeah.
Right? Because, let's face it, he wants to train you to feed him.
Yeah.
And she wants to put the minimal effort into it. And that's basically what happens. But at 4 weeks, the baby is used to you, you're used to it, you've got a rhythm going, your milk is in, they like your milk. So that is when, that's when dad can actually start giving a feed. Yeah. If you're going to go back to work, the dad can help you with the pumping and the storage of the milk. You see? Yeah. So, and let's say, God forbid, you have a baby, and for the first day you can't breastfeed the baby. What can dad do? You can do some manual massage. You can get the little colostrum out. It's only about 5 cc's, which is a teensy little bit. And the big dad can put it in a spoon and give it to the baby, instead of having to use a bottle and then all those problems that happen after the baby's born. You see?
Yeah.
So
dads can do a lot.
Yeah.
Dads can do a lot.
Dads can do a lot. And that's what people don't realize. Oh, I'm going to breastfeed. I'm on my own. You're not on your own. Tag team during the night. You breastfeed, he takes care of the rest. You go back to sleep, he takes care of the burping and the changing and stuff like that. When the baby gets older, look, I need a couple nights of good sleep. I'm going to pump some, you get to do the night feeds. But again, you have to have empathy, you have to have compassion, you have to work together as a team. The dad needs to know how to manage his stress. Let's say you go back to sleep and the baby starts screaming. He can either wake you up or he can learn the stress management techniques, which are fairly easy, as long as you're using like deep breathing or saying a mantra, or you know what I mean? Or, practicing gratitude. And then he goes back to calming the baby down, you see? Because we want dad to have positive experiences. And the more positive experiences he has with the baby, the more the bonding will be secure. And babies with secure bonds to both the parents thrive. They're resilient, they're happy, they're creative. They do really, really well in life.
Yeah, that's amazing. I have a question though. It just popped up into my head because what I often see with relationships and raising their children when they are a little bit older, I often see that they say to the children, be careful because otherwise I will call you dad or I will call you mom. So you create that fear of the other parent. So what are your tips when it comes to that, to not go into that state? Because I know that's how I was raised, be careful because otherwise I will call mom or and I don't think that's fair for either of the parents to do that.
And it's actually not effective parenting.
No, exactly.
Especially when the children are young, the consequence needs to be at the same time as the behavior.
Yeah.
So if you do a behavior, you're 2 or 3 years old. The consequence of the behavior needs to be immediate. So saying, wait until your dad comes home, number one, is not effective because you're going to notice that the kid's going to keep on doing it.
Yeah.
Number two, when the father comes home, he's not going to discipline the kid. He wants to be the good guy.
Yeah.
He's been away at work all day, killing himself, according to his story, which he is. And I'm not saying according to his story in a bad way, but in his mind, unless you've really talked about this, I'm killing myself and now you want me to discipline this kid I haven't seen all day. How are they going to love me? So you're putting a lot of stress on your relationship with your husband. That's two. Number three is they're not going to listen to you. If you keep saying, if you're not you see, I believe that discipline of a child is love. Discipline does not mean punishment. Discipline means that when you do something, let's say you jump in front of a car, you're going to get hit by the car.
Yeah.
That's a consequence, right? Discipline means that you decide what the consequence of the behavior is and you enforce it. The consequence could be going to their room, timeout. The consequence could be going to the calming corner, depending on the child, because, every child needs a little bit different way of discipline because, there's not one size fits all of discipline. Positive discipline is great, but kids aren't going to listen to you for endless. You're sitting down with this 2-year-old and you're talking for half an hour, convincing them. They're going to go back and do it again because children are people of action. Yeah. It's like with breastfeeding. A lot of times when the baby starts to teeth, even in the first year of life, the baby starts to teeth, they'll start chomping down on the breast. Yeah. What can mom do? She can take the baby off immediately, say, no, that's not acceptable behavior. You don't want to use the word no, I'm fine with that. But say that's not acceptable behavior. The baby will scream like you are tearing their hair out or beating them. But basically you have to do that. Otherwise, what happens? You're going to get a cut on your breast and you could get mastitis and not be able to breastfeed for a few days. Yeah. It's dangerous. So that's actually one of the first acts of discipline. You see?
Yeah.
So I believe that discipline is a type of love for the child, and children will always go towards the parents that discipline them in times of trouble because they know I can only go this far. If I go farther than that, mom or dad is going to push me back. So when you're giving the onus of discipline to the father, you're actually telling the child, you can trust your father to keep you safe more than you can trust me.
Yeah, I haven't seen it in that way, but no, you're absolutely right. It's knowing what is coming. You know what to expect.
Mm-hmm. Yeah, and I can trust that.
Yeah.
This is because my dad says something and he does it. My mom says something and she doesn't follow through. Who do you trust?
Yeah, that. And I will push even further. And
Right?
maybe kids, if I look, for example, at my sister, she's really great at it, at pushing and pushing until she cannot go any further. It's also just testing the parent.
Yeah.
Like, how far can I go? Not necessarily because she wants to act out. It's just seeing if she pushes through this time. Like if she really.
It's fun.
Yeah.
It's fun. What I tell people, especially parents of toddlers, your baby, your toddler has nothing better to do than to get you to do what they want you to do.
Yeah.
They've got all day, 24 hours, 7 days a week.
Yeah.
And they're going to do it. You, on the other hand, have a house, maybe a job, a husband, friends, a life, and you forget. So it's really important when you decide that you and dad, again, dads are tremendously important. You sit down and you decide how you're going to discipline and what you're going to do, because consistency is important. Whoever happens to be in the room needs to do the discipline. So it's not like, wait till your dad comes home. It's okay. I'm in the room, I get to discipline. Dad's in the room, dad gets to discipline.
Yeah.
And if you have arguments about discipline, it's tremendously important to take those away from the children, because then they learn, oh, I can go to dad. Yeah. See, I was a disciplinarian in my house, and whenever the children had a problem, guess who they came to? They came to me. I was always the mean mom, and they didn't love me, and I was so mean. But when they had a big problem, I was the person they came to.
Yeah, I think maybe it's also showing strength. So if they are in trouble, you become the provider and the strength to help them out that situation.
Well, they know you're going to tell them the way it is.
Yeah.
See, I'm honest. I didn't like that behavior. I gave them a consequence. I didn't not like the behavior and do nothing.
Yeah, exactly.
It's subtle. The kids are subtle. I mean, the thing is, parents don't realize that children are geniuses, and they get the subtleties. They get the subtleties of human relationships. You're out there busy living your life. They notice everything, and it's important that you notice what you're doing. So, another thing that you want to talk about before the baby's born is, are you going to circumcise your kid or not? Because they're going to ask you in the first couple of days after the baby is born. That's not the time when you want to do your research and decide if you're going to do it or not.
Yeah. And
talk about it. And it's a big topic right now. People are all over the place. I don't have an opinion. I believe that it's a personal thing between, God, source, whatever, the parents and the baby. But there are like medical advantages to circumcision. There are, supposed disadvantages. I don't get into the middle of that. I just tell parents, be ready, because if I'm going to, if you want to circumcise your kids, you want to do it in the first 48 hours, because it's easier to control the pain and everything. Yeah. So that's a decision. Another really important decision they need to talk about is, are you going to work outside the home? Who's going to work outside the home? Because now with gender roles changing, sometimes the dad's a stay-at-home dad, the mom's the provider. Yeah. So, what are your roles going to be? What it's important to talk about that.
Communication is key. Again, like communication, always communication, and self-love as well. I believe that if you, I don't, of course, kids are your everything, but I believe that you come first, your relationship second, and then your child. Because if you don't feel, as we've talked about before, you have to feel great so you can be in a great relationship, so you can be the best parent to your kid.
I don't put it in gradations, because they're all equally important.
Of course, but you
and that's why I talked about in terms of the balance. Sometimes the baby's going to get 100%, and you and your relationship will get nothing. And then you're going to go back, and the baby gets a third, and you get a third. You see, because it's people talk about balance, like you can say the baby's going to get a third, I'm going to get a third, and the relationship's going to get a third. That's not the way life works.
No,
life is very interesting like that. And so what you do is you say, okay, we've neglected this for a few weeks. Let's go back and we'll talk about it as a partnership. Yeah. It's really important for me to go out and get a manicure, because that's my thing. Are you cool with that? Well, I haven't had any time alone either. Okay, I'll go out and get a manicure. You can go out and have a cup of coffee with your friends. Balance it out. This way, it's not all on one side or on the other. And that, even that type of self-care strengthens your relationship because you negotiated.
Yes, exactly.
And that's why conflict resolution is important. Why expressing your that's why active communication is a skill I actually talk about in the book, is how you do it. Because telling somebody you make me feel like this or you did this is just shuts things down. One person's on the defensive and the other isn't. Exactly. And another thing you need to look into is finances, because finances are a huge source of problem in relationship.
Absolutely.
You see, and that needs to be accounted for. Because I think I calculated it's 142,700 mLs of formula for the first year.
Yeah, that's a lot.
Right? So breast milk is obviously the more economic way to go. It's also the healthier way to go.
Yeah.
Diapers, you want to use, these are things that you want to talk about as a couple. Millennials, I know you're very conscious of the ecosystem, but if somebody's going to stay home and you just can't do the eco-friendly, you need to talk about that and not fight about it. Well, I want to use disposable diapers. Well, I don't want to use disposable diapers. So what's a nice, it's a silly thing, but you find when you're overwhelmed and tired, you're going to fight about really silly things. So decide to look into it, because when you get diapers, how much is it going to cost to send them out? Am I going to wash them at home? How many do I need? Then you need the covers. There's all these little things that people don't notice. We need to put that into our budget.
Yeah.
If you decide not to work outside the home, dad decides to stay, who's going to offset that finance? It's important that you have those plans, because that causes a lot of stress in the relationship, and stress in the relationship causes a stressed baby.
Yeah.
And stressed babies are not happy babies. And so it's a vicious cycle.
Exactly.
Which is why, and dad should not be the only one involved in that, because a lot of mothers, I have to say, a lot of mothers will say, well, he takes care of the finances. And I'm thinking, not a good idea, because you need to have a say too. You don't want to have to go to him all the time and say, I need $10 or whatever it is I need, or discover later on that he was doing something with your finances that you didn't like. It's a trust issue, but it's also important. Because both of you need, and I don't think that the wife or the mother should have sole control over that.
It's something you should manage together. Like you should just know.
Put a budget. What's your budget now? What's your budget going to be after the baby's born? Little practical things like this are tremendously important.
Yeah, I'm actually doing another episode about that, because so many people are afraid to look at their finances, but it is so necessary. You need to know what's going in, or what's coming in and what's going out. What can you save? What is really important? What can we, just not buy? Where's the money going? It's so important. And as you said, it's one of the biggest stress factors in a relationship. So you need to get your finances straight.
Because it affects the health of the baby. I mean, because I think people wonder, why as a pediatrician I'm talking about this? Ultimately, I want healthy, happy, resilient babies.
Yeah.
And healthy, happy, resilient babies grow in healthy, happy, resilient homes.
Exactly.
And healthy, happy, resilient homes have a budget.
Yeah.
They have an emergency fund. They've got all sorts of things. And let me talk about the soft skills that parents, I think, can look into while they're pregnant.
Yeah.
About active communication, we talked about how to fight properly. The 5 love languages.
Yes, I love it. Yes. I said I love it. I love love languages. Luckily we discussed it a couple of years ago. We know it.
Which is beautiful. But some parents don't. I mean, because I have mothers coming and saying, my husband doesn't love me. And I'll say, but he did. And then I'll ask him and he'll say, well, I did this, this, and this.
Yes.
And it turns out they're just speaking different love languages. Giving her a gift was not her love language. She wanted him to spend time with her. And once the two partners know what their love languages are, they can start expressing in the way that the other appreciates, or to say, look, I'm giving you a gift because I love you. I need you to know this. I'm trying to learn your love language, but right now this is, and so that's tremendously important. Yeah. Empathy, being able to see what, the mother, the dad, a lot of times will say, well, I want to be intimate with my wife. And the wife is going, I'm I'm fat. My hair is grungy. I haven't slept in days. I haven't showered in days. I don't feel like I want to be intimate. So what ways can you be intimate when you're not actually having sex, when you're not feeling intimate? Can you hold hands? Can you spoon? Can you, walk on the beach? Can you recite poetry? Everybody has their own way. So this is because this comes up a lot. And then stress management techniques, because anybody that thinks that having a child is a walk in the park can come talk to me. And I'm not saying that because I'm mean or anything like that, but I'm a pediatrician and I was shocked. And my children taught me the very best things. I mean, I learned a lot of the things that I learned because of them.
Yeah.
Like I said, when that nasty thing would come out of my mouth that I promised myself, I caught myself. I said, what the heck are you doing? Don't do that. You're teaching people not to do that and you're doing it yourself. You've got to take sometimes a look in the mirror, because what you need to do as a parent is you're teaching your child how to behave. Is this a behavior I want to teach my child?
Yeah.
Do you lash out and say that you're a nasty piece of what? Or do you say, I really didn't like that behavior. Maybe we need to talk about this, depending on obviously the age of the child, because it's a whole thing. Yeah. And then postpartum depression. I think all parents, mothers and fathers, should know about postpartum depression because it can sneak up on you very, very suddenly.
And fathers have it too, right?
Yes. 10 to 20% of mothers can get postpartum depression, and there are risk factors for that. So moms need to know if they have a risk factor for that, because 25 to 50% of partners of a mother with postpartum depression will actually have postpartum depression. I mean, that's a huge number.
Yeah.
It is a huge number. And fathers do not show postpartum depression the way mothers do. Fathers' symptoms are more withdrawal. They're more anger. Mothers will tell me, my husband's personality completely changed after he was born. I don't know who he is.
Yeah.
And you got to know that this is a postpartum depression. And once the father knows that he's not going crazy, he's not less of a man, there's nothing wrong with him, it's just something that he's going through, he can reach out and get help.
Yeah.
And in my book, I actually wrote about, natural ways to deal with postpartum depression, like dietary things, exposure to light, massage. There's little things, because I wish there was a one size fits all pill, but
it's not.
First off, you don't want a pill necessarily for postpartum depression. You want to look at, there's so many facets to it. You work one, is your vitamin D low? Am I getting enough exercise? Am I using screens too much? Am I getting enough sleep? If I'm not getting enough sleep, let me talk to my partner. Let me see who we can garner in our bigger community that can help us with this.
Yes, exactly.
You see, because ignoring a problem doesn't necessarily make it go away. So it's important to know these things before you have the baby, because after the baby comes, you will learn on the fly. But now you have the time.
Exactly.
And you can be proactive, because I like parents to feel empowered. I like a mom and a dad to go into parenting confidently, knowing that they're going to make mistakes, knowing that they're going to do the diaper wrong, knowing that something bad is going to come out of their mouth every once in a while, knowing that they're going to fight, but being able to look in the mirror and say, I'm doing the best I can, and learning from their mistakes, not hiding and saying, oh, I'm a bad person and I'm never going to learn, but, actually saying, okay, I made a mistake. What am I going to do about it?
Exactly. That's the most important part.
Yeah.
So what is the biggest lesson that you've learned or you want to give away about fatherhood or about parenting or anything?
Be aware of how important you are to your child. Be aware that your child is watching you 24/7. And it doesn't matter what you say, it matters what you do.
Yes.
And for fatherhood, please, dads, I want you to know how very, very important you are to your children. And moms, I want you to know how important your partner being involved in the baby is. So do everything you can to facilitate that for him, because it's not easy. Okay. Men don't associate themselves with cuddly, feely, nurturing things. So encourage him. Let him know that you think he's more of a man rather than less of a man because he's changing a diaper. Because that's a societal myth. Oh, he's a woman, he's changing a diaper. Who said changing a diaper is a woman's job? Personally,
I would even say it's a man's job because it's gross.
Yeah. But
well,
you
it's
know,
not
I'm
necessarily a
glad you brought
women's
that
job.
up. In terms of changing a diaper, your mindset about changing a diaper can change to not, it's gross. It's a chance for you to interact with your baby fully, to be fully present. Instead of focusing on the poop and the stinkiness of the poop, focus on the beauty of your baby's body and the way it functions. You know, touch your baby's face and say, oh, and smell their face, because I think baby smell is the most wonderful smell in the world. Smell their baby's face, look at their beautiful eyes, you know, and change, you know, think of that, because before you know it, they won't need diapers anymore. You don't believe that, you know, those 3 years that they're in diapers, it's hard to believe. But I don't believe that my kids are grown up and out of the house. I just don't. I miss those days. I would do anything to go back to the diaper changing days that were stinky and icky.
Yeah, that's true. I can see it with my little sister and with my best friend's kids. I'm like, oh my God, like they grow up so fast. Like it's unreal.
So every mindset is tremendously important. Every interaction you have with your baby can be made into positive or can be made into negative. And that's one of the things I talk about with breastfeeding is, you know, even when you're having problems, every breastfeeding session, especially in the beginning, is its own individual session. Leave the failures of the past behind and say, this is a new moment. I am present in this moment. What can we do moving forward to make this into a success for both of us?
Yes.
Rather than, oh my God, I got to breastfeed this kid again. Is it never going to stop? Because you feel like that sometimes.
Yeah.
But that's a shift in mindset is important. I mean, you know, it's not easy having a baby hanging on your boob for a year and a half, 2 years, or however long you decide to breastfeed. It's not easy when they're pooping 6 to 8 times a day. You know, it's not easy when they're not sleeping through the night. But that's why self-care is so tremendously important, and why the way your mindset about this is tremendously important. Because it can be a pain in your life. It can be something that you don't enjoy, or you can choose. And it's not going to happen every time, Winanda, you know, but every once in a while in a day, you know, you'll come back into presence. You'll be able to focus completely on the baby and truly come into the moment and enjoy that. And the more you practice it, which is why I always recommend practicing these skills before pregnancy, the more you practice it, the more adept you'll get at it, and the more instinctual it will become.
Yeah.
And over the period of 10, 15, 20 years, it'll become a habit. You know, we got to be realistic with ourselves. You know, huge changes in our life are tiny little steps taken consistently.
Exactly. Well, thank you so much. It was really great. Like it's amazing, all the information that you shared, especially from the dad side, like things that I not necessarily didn't know, but you don't really think about because, you know, I'm a woman, so I think differently. And that's why communication with your partner is so important, because it doesn't matter how long you've been together, you just don't know what the other person thinks, how the other person feels.
No. And once you know that, you have a whole depth of relationship that you can enter into. Yeah. And what I want moms and dads to remember, that these skills you're using with your partner are the same skills you're going to use to have a deep, very thriving relationship with your children as they grow up. Yeah. So I always think of the marriage relationship or whatever partnership, it doesn't have to be marriage, you know what I mean, but a partnership is the training ground for parenthood. Because once you learn how to do active communication with your partner, you're not going to jump all over your kid. It'll become more of a habit, and you'll say, maybe I need to listen. Because I always tell parents, toddlerhood is practice for teenage. So the marriage relationship is practice for parenthood. Toddlerhood is practice for teenage, because they're exactly the same behaviors, different sizes, different words.
Yeah. Okay, well, thank you so much for this conversation. How can people reach you if they want to work with you or want to learn more about you and what you're doing?
I have a website, which I need to change. It's kind of slow, but you can reach me there. It's askdrlinda.com. I've got an Instagram page. It's ask.drlinda. And my Facebook is Ask Dr. Linda. I don't do Twitter. I don't know how to do Twitter. It's not my cup of tea.
It's okay.
I do have a YouTube channel, Ask Dr. Linda, but the videos up there are right now were experimental videos and they're not good. But I'm planning on getting that doing. If you would share the link on Kindle to my book, I would really appreciate that one.
Yes, I can do
it. My book is up on Kindle. You can get it on demand if you want a paper copy to use as a reference for because I really don't expect you. I think the way this book needs to be gone through is you go through like one chapter, look at that, practice that, and then move on.
Yeah.
To something else.
I just leave everything in the description box so people can contact you and click the link and do that thing.
Yes, it was a joy talking to you, and then I hope everybody that's listening, benefited something because we're all in this together. Exactly. I mean, and with COVID now, we're really all in this together. And it does take a village to raise a kid, but our villages are now worldwide. I'm in Jordan, you're in
Islands.
Yeah. So, I mean, who knew how we came together? And I really appreciate what you're doing because I think that empowering people to know that they have lots of options and being open to talking about fatherhood, which is a topic that as women, it's interesting for us to be talking about, but we have a lot of influence on our partners.
Yeah, exactly.
So being brave enough to do that.
Yes. Well, okay, thank you so much.
You are welcome.
Thank you so much for listening. If you have any questions when it comes to special needs kids or raising them or anything else, don't be afraid to ask. It's always better to ask than not knowing. So click the link in the description and reach out.